So let's look at cancer screening. Breast cancer. This machine is actually a mammogram machine where we will do the breast screening, and it is indicated in those ladies who are 40s and older, and we recommend it to do every 1 or 2 years. Why not younger than 40 years old? Because in younger than 40 years old, the breast is very dense and we cannot see clearly. But however, in high risk patient, we should start screening at age 35. And this is the mammogram machine. Mammogram is critical. Every lady should do it because breast cancer is still the commonest cancer for ladies, and women at risk. We should even do the screening test in a shorter screening interval with ultrasound or even magnetic resonance imaging. Colorectal cancer. What is the recommended screening for colorectal cancer? Since this is still the second commonest cancer in Malaysia, screening is recommended for all patients who age 50s and older. And what screening test we do is we screen the stool for any blood, which is called FOBT test. And there's the second one. The second screening test is called flexible sigmoidoscopy, where we use a scope to put into through the anus and check whether there is any growth. And a combination of both of these FOBT plus this sigmoidoscopy, or a colonoscopy. The difference between a sigmoidoscopy and a colonoscopy is that sigmoidoscopy is shorter and colonoscopy is longer. Now, if we do FOBT, we recommend to do annually, every year. For sigmoidoscopy, every 3 and 5 years, but ours for colonoscopy every 10 years. Digital rectal examination is currently not recommended. Okay? So this is a colonoscope showing a growth in the colon. For high-risk patients, for those who have this familiar polyposis, ulcerative colitis, adenomatous polyps, or colon cancer, all these are very high-risk patients. They should do more frequent screening to detect colon cancer. Polyposis causes, this is a disease which is hereditary, and this it's like if one of the, let's say if the father have it, it will have, and it will pass on to the sibling, and let's say it's the father got it, all the children will need to undergo colonoscopy, and they even may need to perform surgery, to cut off their colon, take off their colon, to prevent getting colon cancer, because very high chance that they will get into colon cancer. And ulcerative colitis is actually an inflammation in the colon, whereby maybe if you are infected with ulcerative colitis, you may have diarrhea, bloody diarrhea 10 times a day, 6 times a day. Then in the long run, you will have higher risk of colon cancer. So that's why they need, all these high-risk patients need regular screening. For nasopharyngeal cancer, yes, Chinese is easier to get. Nasopharyngeal, the ear, nose, throat cancer.
The reason being? Is there any special reason?
Probably genetic, probably the diet related. And the cervical cancer for ladies. So cervical cancer, I'm sure it is very common, and that's why females are recommended to do pap smear. 1 or 2 years, all women with a cervix, of course, who have been sexually active or who are above 21 years of age or older. Okay? Let's say if if a female already removed the uterus, should they go for pap smear, still good for pap smear? If they remove the uterus because of cancer, they still recommend to do pap smear. So this is how a pap smear is done. This is a brush. So this is a brush and this is the cervix. The brush will be inserted into the cervix and then it will be turned around to get the cells and to check for cervical cancer, because this is the cervix, and this area is prone to get changes. And after we get the samples through the brush, we will put this brush into this bottle. This bottle is to collect the cells, and this is called tin prep. Okay, prostate cancer for men. The American Cancer Society and American Urological Association actually recommended to do digital rectal examination of PSA. PSA is the form of blood test to check for prostate cancer. Okay, men more than 50 years to screen, and even earlier, if a man with a family history of prostate cancer at the age of less than 60 years old. And if screening is to be performed, of course, the patient should be informed of the potential benefit and risk of screening. Because, as I told you, this test is not 100%. Lung cancer, should we screen for lung cancer? It is not yet recommended, insufficient evidence to recommend or against screening. Ovarian cancer, against routine screening. Nasopharyngeal cancer, no effective screening yet. Well, screening for risk factors for heart disease and stroke includes, of course, smoking, high blood pressure, diabetes, lipid, and the cholesterol. We recommend to do it in all men aged 35 and older and women aged 45 and older. Why men 35 and older? Because men tend to get heart disease when they are, like if women, when they are premenopausal, they're actually protected by the hormone. So they're less likely to get heart cancer, heart. Of course, those patients with a high risk of getting a heart disease, like family history of heart disease, diabetes, they should go for screening even earlier, at the age of 20s. High blood pressure, it is important to check your blood pressure at least every 2 years. And what is defined by high blood pressure? There is this systolic blood pressure more than above 140 and the diastolic pressure above 90. Diabetes, okay? Especially those with high blood pressure and high cholesterol should be screened for diabetes. Why prevention is so important? If we get diabetes, high blood pressure, and if we screen earlier, we can prevent all these